Thank you, Chairpersons. I would like to thank G. Vijayakumar for this opportunity, for this talk, which is going to be on offloading of the diabetic foot ulcer. So I'm going to talk about the next 10 to 12 minutes on how to offload diabetic foot ulcer. What is offloading? Offloading is a term which is used for reducing or removing pressure from the ulcerated area to promote healing by minimizing or redistributing the weight bearing forces. That is called offloading. That's the definition of offloading. Now, non-weight bearing is different from offloading. Mechanical offloading is by footwear, and surgical offloading is also there, which is different from mechanical offloading. Mechanical offloading is with footwear, you try to reduce the pressure. The gold standard for offloading is the non-removable cast, TCC, which is considered the gold standard. What you see on the right side is the TCC. Left side is the L-shaped posterior cast, about which I'll be talking about. The posterior cast, if you want to see the ulcer and clean it every day, you should use not a TCC but a posterior cast or L cast, which is shown in this picture. There was a material, an offloading device which was imported from Italy, for which we had to pay the customs duty and so on, and it came to about 14,000 rupees, which the patients would not take it. And the peg insole was about 5,000 rupees. So 19,000 rupees was the total cost. So we developed a low-cost indigenous offloading device, which we published in the IGDDC, Indian Journal of. There was a lot of questions. We answered them all, and we finally published in the IGDDC, which is the official journal of the RSDA. The MB Surgery boot, which is called the low-cost, which is the low-cost offloading device, has a padded inner surface, a toe box which is wide. You can see the toe box which is wide, and the outer sole which is thick, which is it can't bend. It can't bend. If you take a Reebok shoe and bend it, it won't bend. Similarly, a MB Surgery boot will not bend. And these are examples of using the MB Surgery boot, which we published in the IGDDC. Visit 1, the healing days was 35 days for the first. She had an ulcer for about a year, which healed in 35 days. And second patient, it healed in 29 days. And you can see the ulcer healing in this many days. There is a zero insole attached to the MV Surgery boot, which is costing about 3,000 rupees only, compared to the 14,000 which we import from Italy. Peg insole is also used. You can see the peg insole via or a pedobarogram device to measure the in-shoe pressure device. In-shoe pressures can be measured, and you can see the red being removed by the peg insole. TerraHeal is for the heel ulcers. This is to be we imported from Italy, and it's a patented imported product specifically designed for heel ulcers. If you have a patient with a heel ulcer, don't amputate, don't go for below knee amputation, go for debridement and use this TerraHeal, which costs about 10,000 rupees, including customs duty. Can you play the video? It's not coming. You didn't download the video. You must download the video also. I'll finish in 2 minutes. It's not as elaborate as the insulin resistance talk. You download it, then it'll come. Okay. Stepwise is a company which is started by my son, Dr. Vishnu Vijay. And Stepwise is a foot cream. Stepwise has got many products. Foot cream is one. And we give it to all patients with foot problems. And you can see the heel fissures, they're very common. And user 1, user 2, user 3, day 1, day 2, day 3. You can see you should moisturize the foot. Don't forget that. After examining the feet, you should moisturize the feet. The Stepwise has started, my son has started the in-house footwear unit, where we have workers doing the work. And this is the 2027 offloading for the whole world. And we have Dane Vukuc, Chico Bus, Peter Lazarini, David Armstrong, Caroline, Gustav, Ryan Cruz, and Klaus, and myself in the committee for the 2027. 2023 is already there. 2027 offloading IWDDF guidelines. And I would like to thank you for your attention and take
Thank
any
you,
questions.
sir. Actually,